vitamins. So these are that kind of amines which are necessary for the human metabolism and other kind of procedures. Humans cannot synthesize vitamins except some of them, but more of the vitamins we have to intake from the food stuff. Please silent, okay? If you are sleeping, it's I don't care about it, but not to talk. Must be supplied by the diet, serve as variety of function of in the body. So can be two main groups. One is the fat soluble, and we have water soluble vitamins. These are the fat soluble vitamins, the vitamin A, D, A, and K vitamin. The vitamin A, this is the retinol, is the other name of this vitamin. It's a carotenoid. The beta carotene, this is the provitamin converted into the retinol. Retinol you can find in the retina, basically, that's why it's the name. Stored in the liver, plays role in the retina photosensitivity. You learned about it. Cell differentiation and bone and tooth development, it's also take part. So without it, we have abnormal dentin, and also basically the dentin is abnormal, but also the enamel can be a little bit other color. Skin mucosa integrity is necessary for this vitamin, and the daily intake is 0.9 milligram. In case of men, women, it's 0.7 milligram. What are the source of vitamin A? The A provitamin you can find in the carrot. Also the liver, heart, egg, cabbage, watermelon, pumpkin, and tomato, you can find this vitamin. Deficiency can be the night blindness because of the lack of the retinol. Drying and scaling of skin, eye infections, blindness, and also xerostomia and xerophthalmia. So in this case, the salivary flow is not exactly perfect. So because of it, in this case, in some patients who has xerostomia have a larger rate of caries, and larger rate of oral infections. Because if you have no saliva on the mucosa, basically the bacteria easier can infect the epithelium, the oral mucosa. So you can see the retinol take part in the vision, and also can be a hypervitaminosis. Skin, hair, and bone changes, yellow is skin color in this case. Abnormalities of the face, mouth, lips, and also in the jaw, but it's very rare. Vitamin D is the calciferol. As its the name shows, it takes part in the calcium metabolism. Vitamin D2 is this is the ergocalciferol. The vitamin D3 is the cholecalciferol, and the 7-dehydrocholesterol in skin. This is a calciferol precursor. Hormone absorption of calcium and phosphorus. Mobilization and mineralization of the bone. So these are the main function. You can find in the fish liver oil, liver, egg, milk, so dairy products basically. Vitamin D containing margarines, so if you eat margarines also. And exposure of the ultraviolet rays of the sun also can help to produce the vitamin D. Because this is the precursor, the 7-dehydrocholesterol. Maybe you learned about it in biochemistry, but I don't want to talk about it. So these are the source of vitamin D. Deficiency, rickets in babies, soft bones, enlarged joints, enlarged skulls, deformed chest, and spinal curvature, bowed legs, and osteomalacia in adults also can happen, and osteodystrophy, renal disease, and enamel hypoplasia. So you can see the deficiency in the chest. The bone of the chest is abnormal, and O or X leg, in this case, especially in childhood, is very harmful. And this is the enamel hypoplasia. So abnormal development of the enamel. We will talk about next time the fluorosis. The fluorosis also is connecting the manifestation of white spot on the enamel surfaces. diffuse white spot. So it's very, very similar to the enamel hypoplasia. But in case of the enamel hypoplasia, this enamel is weaker than in case of the fluorosis. In fluorosis also there are a lot of spot on the enamel, but it's a hard and strong enamel. In case of the enamel hypoplasia, it's a soft and also soluble enamel, so easier can happen caries. In case of fluorosis, basically it's a very hard enamel, won't be so common the caries, okay? So these are the difference between the fluorosis and between the enamel hypoplasia, but the manifestation is almost the same. Hypervitaminosis also can be increased bone calcium level, increase the risk of the atherosclerosis and pulp calcification, which was I was talking about, when you can find the pulp stone in the pulp chamber, and sometimes the calcification of the root canals. In this situation, it's very difficult to make a root canal treatment. So if you are unable to remove this calcification, you have to extract the tooth many times. But nowadays there are many instruments for it. Basically sonic instrument, and with the help of the sonic instrument we can remove the pulp stone. Like when we remove, for example, the calculus, when we do a scaling, it's very similar, but we use it in the pulp chamber and we remove that pulp stone. So vitamin A is in tocopherol, limited stores in the body, rather in the adipose tissue we can find. Function: prevent oxidation of vitamin A in intestine, protect cell membrane against the oxidation, protect red blood cells. So it's an antioxidant. It's very important antioxidant, the tocopherol, the vitamin A. You can find it plant oils, salad oils, margarines, green vegetables, legumes, nuts, and the minimum for adult is 15 milligram per day. Deficiency not common seen in infants or those with malabsorption, cause red cell hemolysis, and basically this is the red cell hemolysis is the main manifestation of it. Vitamin K, this is the phylloquinone, which has two types. The K1, this is the phylloquinone, the K2 is the menaquinone. It's synthesized by the bacteria. Stored in the liver, function forms prothrombin for the normal blood clotting. You have to know it because there are a lot of blood clotting deficiency, and it's necessary for it. Activation of proteins for the bone formation also is the other important function. You can find it celery, cabbage, spinach, dairy products, liver. Prolonged clotting time, this is the main deficiency. Hemorrhage, biliary tract disease, high risk of candidiasis in the oral cavity, okay? The oral cavity manifestation, high candidiasis. You will learn about the candida. This is a fungi which very common happened, and very common you can find in case of the patient who has denture, total denture or partial denture. The main problem that these patients don't clean this denture, because it's every time, every evening we have to put it into the special solution, a special tablet, cleaning tablet we have to use. Otherwise, if the patient don't remove it, wear it, for example, for a long time, some patients don't take out it for months, and under it can be fungi and very serious inflammation of the palatin and also the oral mucosa. In case of lack of vitamin K, it's much more difficult and much more serious problem happens. So these are the water-soluble vitamins. All of the B vitamins, C, B, and H vitamin. This is the B7. Vitamin B1, this is the thiamine. This is water-soluble, absorbed in the portal circulation. Function: component of coenzyme thiamine pyrophosphate, so the TTP, which catalyze the glucose fat protein breakdown for energy. Needed the formation of DNA and RNA. Needed the synthesis of acetylcholine for the half nerves. Intake 1.1, 1.2 milligram per day. You can find it liver, meats, poultry, whole grain, brown bread, dry beans, peas, and so one. Deficiency classic, disease is the beriberi. This is a motonervic problem. Poor appetite, constipation, mental depression, edema, polyneuritis, and heart failure. So this is the beriberi, this is the neuroskeletal problem, you know. Basically you learned about in biochemistry. Physiology. Vitamin B2, this is the riboflavin, yellow-green fluorescent pigment, no specific storage location, function part of enzyme riboflavin monophosphate, so the FMN, and the flavinoidin difficult FAD. Also needed for the fatty acid and amino acid synthesis. Intake, it's very small, it's necessary 0.50 milligram per 1000 kilojoule intake. So these are the sources: milk, dairy products, liver, egg, legumes, bread. Growth failure, the deficiency, greasy skin, burning, itching, sensitive eyes, delayed wound healing, cheilitis angularis. This is the oral manifestation, okay? So this is the B2, cheilitis angularis. Glossitis, atrophy of filiform papillae, so depapillate tongue. No papilla on the tongue. That's why the general practitioner many times check the tongue of the patient, because sometimes can be seen the signs of lack of vitamin. Shiny red lips and taste loss, because if we have no papillae, we have no tasting in this case. I try to tell you rather the oral manifestation, okay, because these will be the question of exam, okay. Basically the oral manifestation. Some general also can be by the oral manifestation. The vitamin B3, this is the niacin. Tryptophan precursor stored in mostly the liver and muscles, needed for the cell functioning. So also in biochemistry procedure, so constituent of nicotinamide, so NAD and NADP, needed for energy release from carbohydrates, proteins and fats. So the energy releasing, steroid formation, so it's take part formation of the steroid hormones, red blood cell formation, drug metabolism. Vegetables, brown bread and full grain, you can find it. Classic disease, the dermatitis, also diarrhea, mental depression, dementia, delirium, glossitis, and also the nude tongue. So the B2, B3 connecting with glossitis in the mouth and without papillae. Ulcerative gingivitis, so a lot of ulceration you can see in the oral cavity, oral mucosa, stomatitis, cheilitis. These are the main oral manifestations. B5, pantotenic acid, component of coenzyme A, for energy releasing from carbohydrates, proteins and fats. It's take part. Synthesis of vitamin D, fatty acids, cholesterol, steroids. Adults need 5 milligrams. Liver, egg, poultry, milk, and so on you can find. Deficiency, it's very rarely neuritis of arms and legs, burning sensation of feet, muscle cramps, coordination, fatigue, and nausea. No oral implication, so basically it's in the oral cavity not so important. The B6, stored muscle in the liver and muscles, component of coenzyme pyridoxal phosphate PRP, functioning protein amination, deamination and transamination, function in red blood cells and hemoglobin synthesis, function in conversion tryptophan to niacin, and conversion glycogen to glucose. You can find it: liver, meat, dairy products, legumes, non-citric fruits, whole grains, cereals, and the dark green vegetables, potatoes. Deficiency, depression, irritability, nervousness, peripheral, meningitis, cheilitis angularis, dermatitis, also glossitis. Glossodilia, magenta tongue, and stomatitis. Vitamin B9 stored in liver, function, maturation of red blood cells, synthesis DNA, RNA, not substitute for vitamin B12. can find liver, leaf vegetables, legumes, deficiency, birth defects, spina bifida, macrocytic anemia, heart disease, angular chenosis, mucositis, stomatitis, high risk of candidiasis, and burning mouth syndrome. In this case, the patient has always a very heavy pain in the mucosa. It's the burning mouth. There is a syndrome, a typical syndrome, also named by burning mouth syndrome, but we have to see, because if we have so vitamin deficiency behind of it, we can treat it. If it's not working, if you give vitamins, maybe it's a burning mouth syndrome. Vitamin B12 requires intrinsic factor for the stomach for the absorption, function, formation of mature red blood cells, synthesis DNA, RNA. You can find it animal foods only, milk, egg, meat, poultry, and fish. The deficiency is pernicious anemia, macrocytic anemia, neurologic degeneration, delayed wound healing, angular chenosis, burning mouth again, and Hunter glossitis. Okay, sign this because it can be an exam question. Okay, the Hunter glossitis, the B12 connected to the B12. Burning red tongue which has no any kind of papillae on the surface, shiny and smooth the tongue surface. And halitosis, it's very common of this patient. So you can see the smell of this patient, okay? In this case also we have to use any kind of chlorhexidine and mouth rinses we have to use, okay? And we have to give, yes, of course, B12. Vitamin B13, the oroacin, it is a very important antioxidant, protect against liver disease, and very small we need 0.003 milligrams. Good vegetables, meals you can find. We have to talk about the most important vitamin, the vitamin C. This is the ascorbic acid. You can see the structure, the chemical structure. Not stored in the body, but the concentration in tissues with the greatest metabolic, it depends on the greatest metabolic activity. Function, the most important function, formation of collagen, okay? The collagen fibers, keeps these in films in gum. Hormone synthesis, wound healing, take part in the wound healing, resistance to infection, and improves iron absorption. In adults, in case of adults, 90 between 75 milligram is necessary for a day, okay? But 60 it's enough basically. But if you take a little bit more, it's not a problem. This is the chemical structure. Basically, a Hungarian scientist, Szent-Györgyi, isolated at first in 1930 and get a Nobel Prize because of it. Source of vitamin C, citric fruits, rose hips, green paprika, sour cabbage, strawberries, tomatoes, and raw green vegetables, and also the broccoli you can find it. So this is the rose hip. And in the sour cabbage you can find a lot. And it was basically the deficiency of the sailors. It was the scurvy or scorbut. Poor wound healing in this case. Poor bone and tooth development, bleeding gums, loose teeth, high blood vessel fragility, red swollen gingiva, petechiae and bleeding because the blood vessels are very fragile also. Burning mouth and ulcerations in the oral cavity. The oral infections are much more common happen. High risk for infections, tooth mobility and malformed enamel also. It was basically the disease of the sailors because they were in a long voyage, long shipping, not eat vitamin C content foods. That's why the sour cabbage was taken by these sailors, and it was compulsory to eat the daily rate everybody.
I thought they took lemon juice with them.
Again, this.
I read they took lemon juice with them.
Yes, also it's useful, and maybe they take of it.
It doesn't get exploded.
Yes, but the sour cabbage I read basically in the history. It was necessary, everybody.
But it's the pickled one.
Yes.
Yeah.
If they don't eat, they have a penalty. Vitamin C excess also can be chronic overdosing can increase the vitamin C metabolism as an adaptation and can be a rebound scurvy may occur after dose normalization. Increased risk of stone in the kidney if you eat too much vitamin C, okay? Vitamin B, this is the citrin or lutein. This is a bioflavonoid, help the absorption of vitamin C and protect against the oxidation of the vitamin C. Attendant of vitamin C, it's help basically the absorption. It's a co-vitamin we can have. No deficiency and excess, but it's easier the usage of vitamin C if we eat vitamin and use vitamin B. Source of vitamin P, citric fruits, broccoli, tomatoes, and cranberries. Vitamin H is the biotin, protective vitamin of the epithelium, but protection of epithelium is not perfect and not exactly deficiency. One thing, okay, I would like to tell you because it also can be exam question, okay? I go back for the lecture, the Stephen curvature, because in exam, you don't know what does it mean, okay? Just for a minute, okay? I won't have again the lecture, I don't want just the Stephen curvature, that you have to know what is that and the critical pH, because Dr. Barna always asks it. 1 minute, okay? And after you can go 5 minutes, okay? 5 minutes, please. Cannot find nutrition.
On the right.
It's so many.
You mean nutrition and diet in relation to
Yeah. Which is
the right column? The most right column? Lower quarter. A little bit more there.
Yeah, back. Okay. I got it. Okay, that's it. Okay, the Stephen curvature. So you can see a picture here. What does it mean, the Stephen curvature? It's basically
I
you can
remember
see
it
the
was in the
pH
first-
as again, please.
In the first year we had it.
Okay.
If something is oily, it decreases. It doesn't
Okay,
affect
so you
acidity.
know it because it's your big question. Okay, and
Okay,
you have to know the
explain.
critical pH.
Explain.
Explain, okay? So basically, by the time if you eat something, especially if you eat some carbohydrate containing some sweet, some candy, for example, which contains carbohydrates. By the time the bacteria will produce organic acid because it's a substrate for the bacteria, and the pH in the tooth surface, on the tooth surface, in the plaque, will be decreased. You know, what is the normal pH in the oral cavity?
Above the 5.7.
6 between 7 it's the normal pH in the oral cavity. It's neutral, around the neutral, okay? A little bit acidic, but it's a very little bit, okay? But it's around 7 between. But if you eat some carbohydrates or that kind of food which substrate for the bacteria, in this case, the bacteria can fermentate it, make organic acid. It will be an acidic environment, and by the time on the surface of the plaque will be the pH lower and lower, so it's decreased. So it's decreased, and if you go under the critical pH, the rate of the balance of the demineralization will be higher than the remineralization. So in this case, the caries is starting to developing, okay? So that's the most important point of this. So every foodstuff has a Stephen curvature. How is it working? If you see, for example, the chocolate, bread, cookie, and apples, you can see that they are collagen because the pH will decrease until 3.5 between 4. If you clean the plaque on the tooth surface, again it will be normal. But there are some foodstuff, for example, the cheese, which has oilic. Basically, the oilic and not carbohydrate content foodstuff, rather caries protective or non-cariogen. If you see in this case, it's not decreasing, rather increasing the pH. Because in the dairy products, you have a lot of calcium, which have the remineralization of the enamel, okay? Also, it's oilic, so it's covered the surface of the tooth, so it's protect. So the Stephen curvature is quite different in this case, not below the critical pH. The critical pH is at around 5.5. From 5.2 to 5.7, you have to. Okay, so basically the average is 5.5. Under it, it's rather demineralization. Above it, it's rather remineralization. Okay, so this balance is very important when we are talking about the development of the caries. Okay, that's it. I would like to talk to you, and we are ready.
Thank you so much.
Okay.